Hi, my name is Phyllis Stanton. I am the daughter of Tom Deary, who has been a paraplegic for 30 years due to a car accident and open heart surgery um, that ultimately caused the paraplegia. Um, if I could summarize my image of nursing in one word, that word would be compassion. On a negative note, one instance in which a nurse could have made a difference but did not was a time that my father went into the hospital, um, and the physician decided to administer to him a drug that was on his allergy bracelets. He wears two allergy bracelets when he goes into the hospital because he has so many medications that he has allergic reactions to. This bracelet was ignored, and my mother brought it to the attention of the nurses and the physician. No one listened to my mother. And the ultimate result was that my father ended up spending 3 days in intensive care tied to a bed because the medication, by the time they stopped it, had had it was a sedative that he had a severe adverse reaction to, and it took them that long to get it out of the system. One more negative effect that a nurse has had on my father has been a situation in which a dental nurse did not recognize the generic name of an antibiotic that my father was allergic to, that was on his list of allergies. Um, and so she gave him the medication. And when he took it, the reaction was so severe that his hair fell out, and his body swelled up, and he lost all of his skin. Um, his skin sloughed off, and it was the physician also explained that it wasn't just an external um, reaction; it was an internal reaction. Also, all of his internal organs also sloughed off um, their outer layers. Severe reaction, just simply because we did not um, do due diligence in looking at those medications and whether or not he was allergic or not. And how has an interaction with a nurse made a difference in my life? Um, on a positive note, um, we have had nurses that have been extraordinary advocates for my father in the hospital system, that have been able to make sure that he was getting the very best of care, was asking the difficult questions, was fighting for the things that he needed, and just extraordinary care. Um, if I could have any recommendations for future nurses, it would be to pay attention to your patients and to their families. Um, the, my mother's been in a number of situations in which she knows um, what's best, and she explains what she thinks is best, and no one listens to her. And my father has suffered because people did not listen to her. Um, those were just two examples, but do due diligence. Check your files. Make sure your medications line up. Medications are very dangerous. Make sure that you are paying attention to those minute details, and that you're an advocate for the patient. Um, stand up to those doctors who that want to go against common sense, um, for the sake of those patients.